All right, let's dive right in. Today, we're looking at a medical practice that's really rethinking the whole doctor's visit. And they're doing it by focusing on one simple but incredibly powerful tool: just talking. This is a case study in what can happen when you change the foundation of patient care. So let me ask you something, and be honest. Have you ever been in that little room trying to explain what's going on with you, but you feel like you're literally fighting a ticking clock? You've got your list of questions ready, but you're lucky if you get through one or two before it's all over. If you're nodding your head right now, well, you are definitely not alone. That feeling of being rushed, of not really being heard, it's a huge issue in healthcare for so many of us. But what if there was another way? This one sentence is the entire philosophy behind our source material today, a practice called Bridgewater Neurology. They're basically saying that the most important diagnostic tool isn't some fancy machine or a lab test. It's a real, honest-to-goodness conversation. Okay, so that's a nice idea, right? Patient first. But what does a promise like that actually look like in the real world? Let's break down how that philosophy totally transforms what a doctor's appointment can be. Their entire approach is built on three really solid pillars. First up, they get rid of that ticking clock. There are no time limits on your visit. It takes as long as it takes, simple as that. Second, to make sure you're truly heard, you can ask as many questions as you need to, no limits. And third, the support doesn't stop when you walk out the door. You get to communicate directly with your provider after the visit. And look, these aren't just suggestions, this is their actual policy. And when you put these two models side by side, the difference is it's night and day. Most of us are used to the standard visit, limited time, and good luck getting in touch afterward. This other way completely flips the script. We're talking no time limits and direct access. This isn't just about a few extra minutes. It's a fundamental shift in the entire relationship between you and your doctor. So you might be wondering, why is this conversational, unhurried approach so incredibly important for the field of neurology specifically? Well, it's because to understand the brain, you have to understand the entire person. So first, just a real quick refresher. Neurology is the part of medicine that's all about our nervous system. That means the brain, the spinal cord, and that massive network of nerves running through your whole body. Just think of it like this. The nervous system is the body's master control center. It's this unbelievably complex network that coordinates everything. Your thoughts, your movements, your senses, literally everything you do. And this quote from the source just hits the nail on the head. Because the brain is the master control, when something goes wrong there, it's rarely a simple, isolated issue. It can create ripple effects that touch every single part of a person's life. And that is why a deep, unhurried conversation isn't just a nice to have, it is absolutely essential to get to the right diagnosis. And you know, this approach isn't just for some small, niche group. This practice helps adult patients from the age of 15 all the way up to 99. That just shows you the need for time, for attention, for a real conversation in healthcare. It's universal. It spans almost our entire adult lives. So this is great, but how do we take the lessons here and apply them to our own healthcare journey? Well, we can actually take their patient-first promises and turn them into a powerful checklist for ourselves. The next time you're looking for a doctor, or even just thinking about your current one, try asking these questions. Will I have enough time to actually go over all my concerns? Is it okay if I ask all the questions I have? What's the best way to communicate with you after the visit? And maybe the most important one, do you see our conversation as the real start of the diagnostic process? These questions help you find out if a practice really walks the walk. Because ultimately, this is all about changing the entire goal of a medical visit. It's not just about walking out with a name for your condition or a prescription. No, it's about walking out with a shared understanding between you and your doctor. It's about being a true partner in your own health. And that really leaves us all with one final question to think about. Consider your last doctor's visit. Was it a transaction or was it a conversation? The answer to that question might just tell you everything you need to know about the quality of care you're getting.